Hi, I'm Gracie and I will be helping you learn about your Tenckhoff catheter with Marty demonstrating. A Tenckhoff catheter is a thin, flexible tube that is placed in your abdomen to help drain fluid, called ascites. Draining the fluid can help relieve symptoms of pressure, bloating, and discomfort in your abdomen. Part of the tubing will be outside of your stomach and will have a drain on-off switch to allow you to drain fluid into the collection device. Your provider will tell you how often and how much fluid you should be draining. There are different versions of Tenckhoff catheters, so you may notice that yours looks a little different than this one. To change the dressing, begin by gathering the supplies, including 2 dressings, mild soap and water, gloves, gauze pads, skin protective wipes, and UC strip or tape and a safety pin to secure the end of the catheter. Wash your hands with warm water and soap for at least 20 seconds. Then put on a pair of gloves. Gently remove the old dressing while holding the catheter in place to prevent pulling. Throw away the old dressing. While holding the catheter, wet a gauze pad with soapy water and use it to clean the exit site and skin around it. Clean the catheter by holding it and wrapping the moist gauze pad around it, moving in a direction away from your skin. Rinse the exit site and catheter with a fresh, damp gauze pad, and then dry the catheter and skin with a dry gauze pad. Inspect your skin for any signs of infection, including redness, foul-smelling drainage, or new leakage. If any of these signs are present, contact your provider immediately. Wipe the skin around the catheter with a skin prep protective wipe. Place your new dressing over the insertion site. Secure the tubing by using a UC strip or tape and a pin as needed to prevent pulling. To drain the fluid, prepare a clean area to work. Your area should allow the collection device to be below your abdomen. Wash your hands with soap and warm water for at least 20 seconds prior to beginning. Gather your supplies, including gloves, 2 alcohol swabs, a graduated cylinder or collection device, a clean towel, and a wastebasket to throw away old supplies. Open the 2 alcohol swabs. If you prefer to use gloves, now is a good time to put them on. Hold the catheter with your non-dominant hand and remove the cap. Clean the new exposed end of the flow switch with an alcohol pad. Hold the end of the flow switch over the collection device, being careful not to touch the ends of the flow switch to the sides of the collection device. Change the flow switch to the on position. Fluid should begin draining out. If the fluid stops draining and you believe that there is still some in your abdomen, shift from side to side. Draining fluid can take about 5 to 10 minutes. Once you have drained the correct amount of fluid, slide the flow switch to the off position. Clean the end of the flow switch with the second alcohol pad and replace the cap. Flush the drainage down the toilet and wash your hands again. There may be some issues with your Tenckhoff drain. If you notice no fluid is coming out when you attempt to drain the catheter, try the following. Check to see if the cap on the flow switch was removed. Check to see if the flow switch is in the on position. Tilt from side to side to change your position. Check for kinks in the catheter. If the dressing is getting soaked at the catheter exit site, try the following. When showering, make sure that your dressing is well covered. If it gets wet during the shower, change the dressing immediately after. If the dressing is becoming wet during the day from leaking fluid, your doctor may want to change how often you are draining the catheter. The following are times to call your healthcare provider. If you feel lightheaded or dizzy, if you have a fever of 100.4 Fahrenheit or higher, if you have much less or much more drainage than you normally have, if the fluid looks different than usual, if the drainage is bloody, has an odor, or is cloudy, if you have redness or pain around the exit site of your catheter, or if you think the catheter may have become pulled out.
On behalf of ThedaCare, we wanted to thank you for allowing us to be part of your healthcare journey.
Thank you.
Thank you. Thank you.
Thank you.
Thank you. Thank you.